So I'm actually going to start. One of the goals of doing these workshops is actually to kind of really sort of relate to our bodies in a slightly different way, which is less thinking about our bodies or kind of like connecting to information. I'm putting quotes around that just because a lot of the information that we get is problematic, you know, in terms of it being like either a sales type of a thing, you know, articles that aren't really articles, they're really there to sell supplements, those kinds of things. But really, I wanted to start this today by first sort of doing like a little visualization. If you feel better having your camera off for this, that's totally fine. And then I'll go through sort of like what the plan is for today, and then we'll go ahead and jump in. So here's the visualization. So if you'd like to close your eyes and take a deep breath. Let's actually do a couple of those deep breaths. All right, and if you can sort of think about and feel what it feels like to put your face on your pillow and pull your blanket up over your shoulder, snuggle down into bed. And then if you can picture yourself falling asleep. And now if you can kind of go inside your body and see all of the things that are happening while you're sleeping. You can picture your bones and how those minerals are getting put into your bones, and your bones are strengthening. You can move into your bone marrow and look at how it's producing T cells, which will travel around your body fighting infection and finding any abnormal cells. Then you can move up to your brain and look at how it's filing away those memories so that they can be easily retrieved. And then you can go to your skin and to any cuts or wounds that you have. Sort of picture how those cells are knitting together the skin, healing. You can picture your muscles growing. And then now imagine the sun coming up and you're waking up from a deep and restful sleep and feeling well rested. Maybe you yawn or stretch and open your eyes. All right. I haven't practiced very much doing meditation, so I'm working on it. But I hope that kind of gave you a moment to just sort of feel in your own body sleep and what sleep is and what it feels like to sleep. I think, you know, just to kind of give a general overview about this topic, there's some people that I see in the office who I really need to underscore the importance of sleep, partially because the main issue that a lot of people have with sleep is that they just don't have or allow enough time for sleep and rest. This is very often there's various, you know, some people, you know, work 2 jobs and have 3 kids and literally like they don't have that kind of time. And then sometimes people feel like they don't have that amount of time. And, you know, and also when they really look at their day and we look at like the hours of their day, there's hours spent doing things, you know, like social media or watching TV that may not be really serving them, but are keeping them from sleeping more. So that's something we'll kind of come back to. So I'm assuming, you know, you all being here and showing up for this talk, I'm assuming that you don't really need to hear the like, why do we need to sleep? Because you're here and you're here to learn about it. The other thing, part of the reason I'm actually not going too far into that, and I specifically chose not to dive into, you know, what are the health benefits of sleep, is that I find that often when people are having trouble sleeping, that actually creates more stress for them. So they're awake thinking about how if they don't sleep enough, they're going to get cancer. And that doesn't help. So that's why we're not going to go into that here. But I do really want to say, you know, when people are having trouble sleeping, you know, getting sleep like naps and, you know, even if there's interrupted sleep, that still is really helpful and very good for your health as well. So, so we'll talk through all these things. And then also I just want to invite any of you, if you find that you need, you know, try some of these things, or if you have any questions about them, or if you need extra support for sleep, just reach out and we can talk about things individually. That today I will be really focusing on just working with teas and behavior changes and foods. And the part of that is because most of the things that we use for sleep in terms of supplements, I don't want to talk about in this forum, just because there's so many potential interactions with medications or potential side effects that I feel very comfortable recommending teas because they're low dose and they don't have that same potential for interactions. But yeah, just to kind of in preparation, I won't be going as far as talking about supplements. But there's plenty of things to talk about before we talk about supplements. And actually, I find that the things that we're going to talk about today are more effective than supplements. So including melatonin, I know a lot of people really feel strongly about melatonin, but I can tell you that what we're going to talk about today is works better. So first I'll kind of run through what the outline is for today, so that we know where we're headed. If we can hold questions until I say, do we have any questions? If you have a question, if you can just write it down, and then we can answer that question when I say anybody have a question, that would be great. All right. Mostly the reason I say that is because I tend to get a little bit distracted sometimes, and I notice that I'll kind of like, take us all for a ride. so that's why it really helps me if that can happen during those question times. All right. So first I wanted to start with behaviors that support sleep. So there's a lot of, it's hard to talk about behaviors that support sleep without talking about behaviors that don't support sleep. And I think a lot of us kind of, know those and love them, because yeah, that's a lot of the things that are on this list are things that we all love to do. So the big one, I think, that I find, that can be the most impactful for people is really about screens. And that includes phone screens, that includes computer screens, that includes TV screens. That, really 2 hours before bedtime, for a lot of people, they really need to cut that off 2 hours before bedtime. And the reason for that is that we have a little pineal gland, which is the gland that makes melatonin. And melatonin is the hormone that controls our sleep-wake cycle. So if that pineal gland responds quite a bit to light. And this also even includes like bright white lights, especially those compact fluorescents. They actually have quite a lot of white light, unless you get the yellow ones. And so anytime we're having light exposure, it signals to that pineal gland, it must be daytime, it must be time to stay awake, we better not produce much melatonin. So if you're up until the very moment that you're going to sleep, you've got that light coming in your eyes, that sleep-wake cycle is going to be very confused about what's happening right now, because it was just morning and now we're trying to go to sleep. So that pineal gland has not caught up to even like really artificial light, electric light. It's used to kind of that light input being really about sun and darkness. So the really using only red night lights at night or in the bedroom and the bathroom as well. So a lot of times people will say, oh, I wake up to go to the bathroom and then I'm awake for, sometimes for the rest of the night. Sometimes I'm awake for 2 hours. I find that very often a simple switch out is to put a red night light instead of turning on the bathroom light, put a red night light in the bathroom. And that way, and make sure you're safe walking. You can use like a red flashlight as well, or red headlamp if you need to be able to get to the bathroom. But really being careful, and especially in the middle of the night and right before bedtime, about what kind of light you're exposed to. So even, I use a reading lamp for my book, and I found one that's like a deep amber color, and that's pretty good. Red would be even better. Because red really is one of the light frequencies that does not stimulate our pineal gland. So it doesn't tell us that it's time to wake up. So just doing that can make a big difference. And then, the part, again, kind of like working our way down, those I started with the things that tend to be the biggest culprits in terms of things that really disrupt people's sleep. And now we're going to work to, how do we, change our environment in order to make it darker so that our pineal gland can really respond and with a sleep response. I find that, using blackout curtains and really making the room very dark is really important. And this is something, it's interesting. This does get more pronounced really, as people move from like 40 to 50 to 60, that light sensitivity actually gets more pronounced. So you might have been able to sleep in a bedroom where, there's a street light outside for your whole life, and then all of a sudden now you wake up at 4:30 a.m. and can't go back to sleep. So so really the blackout curtains, you have a good situation if you can't see your hand in front of your face and you're dark and it's that dark. A lot of times it's pretty hard to make it that dark. Even for some people, the sensitivity to light can be so much that the green light on their fire alarm can actually be disruptive to their sleep hormones. It sounds kind of like excessive, but actually that is really, really something that I've seen before. And people getting something, like I say, oh, is there any sort of new source of light? And they're like, no. And then they come back and they're like, wait, actually, we got this thing that has this green light on it, like a fan or something. And then they put a piece of tape over it and it gets better. So certainly it seems like there's something that really can happen there. Wearing a sleep mask is a great way. If you can't fully control the amount of light in your bedroom, if you wear a sleep mask, you can that can block the light, even if there is some light happening in the room. Taking a hot shower before bed is a really good one, because that heat and then the responsive cooling that happens, or your body's turning on its cooling response, actually helps you produce more serotonin and melatonin. So that's a really good one for if you want to take it even up a notch. You can use Epsom salts and rub those on your skin, or you can take an Epsom salt bath. Epsom salts actually give you even more of support for sleep, because they contain magnesium and sulfate, which both really the sulfate kind of helps the magnesium come in, and the magnesium is really helpful for breaking down any of those that epinephrine and norepinephrine, which are really our wake up neurotransmitters. They help this enzyme, COMT enzyme, to break those down so that we get rid of them. And one of the ways that we know that those are still high is when people say that they go to bed, they lie down, and their thoughts just race. That's how we know that there's high. So if you're a person that notices that, then an Epsom salt bath might be a really fantastic treatment for you. Or even getting in the shower, hot shower, and take the Epsom salts, put them in your hand, and just rub them on your body. That can work as well. So we're gonna at the end, in the resources, there's a bunch of different resources, but there's a lot of good meditations and sleep stories out there. I really love the sleep stories, I have to say. I love the meditations, are great too. And also, if you're in one of those places where you're really trying to sleep and you can't sleep, I find that the meditations can sometimes be a little bit, I was going to say obnoxious, but they're not obnoxious. It just can be hard, because there's this like space and they're like, okay, breathe deeply. And you're like, I'm trying, like I can't, or either that, or you just pick up on that last thought that you were just having and it keeps on spinning. So maybe I'm just speaking about myself. I'm not sure there. Actually, no, I know I'm not, because I've had people tell me that too. So sleep stories are this newer thing that has been out there, and the Calm app has the best ones that I know of. I haven't actually found ones that were quite as good as Calm app. What they do, so they take from cognitive behavioral therapy, we know that there's these words that are suggestive to our subconscious about deeper sleep. I actually don't know what all the words are, but but some of them, I remember seeing a list somewhere, and they're actually quite surprising. So what they do is they tell you a story, and a lot of times they have actors and things, people with very nice voices telling these stories, and they don't do the breathy thing. So that's also really nice about these stories. But they tell you a story that might be about, one of them that I realize is about a train, and it's like going, and then there's another one about a kid who has a telescope, and it's like, it's telling you the story, and you can try really hard to stay awake during the story, and it's actually impossible. I do know one person who was able to stay awake, and I was quite impressed, but it just sort of brings you into sleep, and you actually, I find that it really improves the quality of my sleep. And they've done studies about it to show that when these stories with these suggestive words are in them, people actually sleep deeper, and they don't wake up as much, and they sleep further into the morning. So it's amazing. Our brains are very complex, that can work. So again, at the end, we'll talk through the resources that I've found, but there's plenty more out there. So you can also, explore out there. The other thing that has been shown to improve sleep is meditation during the day. So if you, that actually doing a meditation during the day helps to modulate your stress hormones in a way that makes you sleep better at night. So so that's a really big one. We've talked a lot about meditation practice in various different, classes and from very different, just various perspectives, but really so much research supports meditation for benefits in so many different ways that even 5 or 10 minutes can make a very big difference. And meditation doesn't have to look like just sitting in silence. Most of the time it can look like, listening to meditations, and listening to, sort of guided meditations, those kinds of things. So, and then physical activity. So I know I kind of feel like I talk about this between blueberries and physical activities. Here we are again, but really a lot of times sleep disruption is a symptom of inadequate physical activity. So I remember one of the times that I did a sort of accidental experiment with this was when I shouldn't say experiment because that sounds kind of awful, but my kid broke his leg when he was 3, and he was always like this fantastic sleeper and, and just, pretty mellow guy. And he broke his leg, and that meant, of course, he couldn't be like running 90% of the time. And it was really striking. He like woke up every 2 hours, like his just, so many things about him just shifted. And it really, really showed me that, that really for him, especially that, I could see, it was like the first time I could really see it that clearly, where you'd have somebody who'd be that physically active suddenly become not physically active. And what that really meant, for his sleep. I will say in the clinic, much more subtly, I've seen that so many times that when people go through periods of time where they, for any reason, are not as physically active, that they don't sleep as well. Even, there's been studies about this that, even 10 minutes of physical activity can make a big difference. So it doesn't have to be this major workout. But it does seem like there is more is better in terms of improving sleep quality. But even 10 minutes can make a significant improvement in the quality of sleep. So, and I really can. Sometimes there's certain types of sleep difficulties, particularly that frequent waking, that can very much be a symptom of not enough physical activity. So, and then there's an acupressure point here. Does everybody have the handout? I'm not sure if did everybody see the handout? I can actually, here, I'll share it here. All right. Let's see. Okay, this is an acupressure point. Does everybody see that? Oh, wait, it's not up yet, is it? There we go. This is an acupressure point that you can rub right before bed. There we go. This is an acupressure point that you can rub right before bed. It's called Kidney 1. It's a very grounding and calming acupressure point. And I find, actually, I had somebody who didn't really respond well to a lot of different supplements, and then we tried this, and that was the thing that really worked the best for her. So it's kind of also a nice little sort of bedtime routine, is to get into bed and rub that spot there. Some people, sort of fancy it up by adding some essential oils or using magnesium oil or something like that. But you can do it without just rubbing that spot is what makes the big difference there. And that, to be also about that, the essential oils, I think that we need to be cautious with those. Sometimes they are very powerful, and sometimes, I don't recommend putting essential oils directly on your skin because they can create a lot of irritation. And I've seen it happen where people have that irritation on their foot, and they, so I don't recommend trying that for the first time on your foot. So that's kind of looking at, all of these different behaviors. I mean, I realize this is a hefty list. Like these are the things that most of us are working on all the time, is to make some of these. I mean, definitely we're not usually working on making our room darker, but the sort of increasing physical activity, reducing our screen time, those kinds of things. So does anybody have any questions about those, or about how to implement these changes? Yep, Linda?
How long do you have to do that acupuncture?
Oh, yeah, about a minute is good.
And does it matter what kind of sleep mask you have?
Nope. I mean, really, looking for one that looks comfortable to you. There's so many choices out there right now. So Yeah, it really is. Just find whatever looks good to you. Yep, Lynn.
I have one that is failing me to a degree. It's pale blue, so I recommend going for black. Just saying, it's very cute. It has little eyelashes or something on it, but it lets in a lot of light. It seems so you have to be aware of that.
I wouldn't have even thought about that, but yeah,
Yeah, me either.
totally right. So you might get this really cute one. Yeah. Some people like them to be a little bit heavier, to almost have like a little bit of pressure. And for some people, that's really not nice. They even have these ones that kind of like bubble out, so it doesn't put any pressure on your eyes. If you prefer to not have any pressure on your eyes. Mm-hmm.
I have a question. So I like to read at night before bed.
Mm-hmm.
And I have the blue light blocking glasses.
Mm-hmm.
Effective as opposed, because I don't know if I would want to put red light bulbs in my lamps, because every time you go in the room, it's like, is it going to be like a brothel? Oh, and then you probably won't be able to see anything like red. So how effective is that? I mean, is that bad? Because reading kind of takes it down for me a few notches, and it's like, oh, but then if I'm worsening the situation by having the light, but the glasses, would that count?
Yeah. The glasses are definitely helpful. Like they're, especially if you are looking at screens, they're really fantastic for reducing that. So blue light blocking glasses, they're kind of have a slight yellowish tint. They're available all over the internet, and they're great actually for a lot of reasons. You do still get some of the light kind of coming in the sides. So what I'd recommend is actually making the light bulb like a yellowish light bulb, so it's not that bright white. Works really well. And then for some people, even depending on if you're having a lot of challenges with sleep, it seems extreme, but if you're having difficulty with sleeping, if you have like an e-reader or anything, you can use an e-reader and have the text be white and the background be black, and then and it's sort of backlit so that you don't even actually need a light. You can read it just from where it is, and it's very low light. So that's another possibility. And also there's that the little clip-on reading light that has you can get a red one of those as well. So all of those are possibilities for lighting. But yeah, I think you're pretty well covered. I would start with, since it's kind of the setup that you have, starting with the blue light blocking glasses and the yellow lamp is great, and then take it down those other notches if needed, if you find it.
The other thing that I do during the day now, I also discovered you can make your screen monochrome, black and white. So your computer is all black and white. You can do it. I have a Mac, so you can do it on the Mac, and I absolutely love it because it's not that I have it on my phone, all my devices, because you're not going like bam in your face with the lights. You should try it. If anybody try turning it and just getting black and white on your screen. It's amazing. It's so much easier on your eyes. It just doesn't like do that to you. So
that's a great one. Yeah, I do the one where it's like, I didn't realize you could make it all black and white. I do the one where it's like the dark background and the white words, so that it isn't quite that like same kind of brightness. And also too, like turning down that brightness on your screen can be helpful too. Even just like, for that, as much for sort of eye fatigue as for sleep, really, yeah, that's fantastic.
The eyes, yeah. So
you can take it down
for the day.
Yeah, thank you. Anybody else? Any questions, thoughts, things that have worked for you in terms of behaviors? No? Okay. All right, as we get started, I'm just going to mute everybody so that we can, so we don't get any background noise. So foods to eat to support serotonin production, and these are really foods to incorporate throughout the day if you're having difficulty sleeping. For some people, I do recommend them right before bed, and specifically what I recommend before bed is turkey and almond butter are my two go-tos that have are actually evidence-based to help with sleep. So, and sometimes really like, turkey or almond butter right before bed is a prescription that I've been known to have, especially if the time that I tend to do it the most is if people are having this early morning waking with a lot of anxious feelings and anxious thoughts that sometimes indicates to us that there's a blood sugar low that happens in the morning. And there's a lot of things we need to kind of ask if that's happening, is like, is that person having sleep apnea? Because a lot of times sleep apnea will sort of make a person could make a person have lower blood sugar. If they're having frequent waking, sometimes that can do it as well. But really that kind of, almond butter before bed, especially if people are having that low blood sugar symptom picture in the morning, sometimes on top of feeling like a little bit anxious, they can also feel sort of jittery, or they can sometimes even have like a food aversion, feel a little bit nauseous, which seems like a funny thing as an indicator of low blood sugar, but that's something that definitely presents. I always kind of wonder why that's a symptom because of low blood sugar, because that doesn't really help. Like you need to eat when you have low blood sugar. So if you have any questions about that, particularly, you're welcome to ask them in this forum. That would be kind of, if you're okay with disclosing that that's a challenge for you, but also you're welcome to ask me about that at another time as well. So turkey is great. Bananas also do have tryptophan. There's this back and forth about whether or not tryptophan is only in the peels or whether it's in the banana itself. It does have magnesium and potassium. And so for people that tend towards kind of getting muscle cramps or muscle tightness at night, bananas are great in the evening. The reason they're not part of my sort of prescription for when people have trouble sleeping is that also they do have quite a bit of sugars in them. And so for some people, eating those sugars before bed will actually cause them to have that low blood sugar in the morning. So I don't want to create a whole other problem. And I should have said that when I was talking about the low blood sugar in the morning, is that's another major consideration is a person, the sort of classic thing that I see that causes that low blood sugar in the morning is a person eats dinner at 7 o'clock, 9 o'clock, 10 o'clock, hits the freezer or hits the cabinet for some sweets, and then they'll get a low blood sugar in the morning because of the way that they metabolize that sugar. So very often it's a hard switch off, but the trade-off from ice cream to turkey is a little hard sell, but there it is. That actually does help with that morning blood sugar. And then almonds and almond butter, of course, they actually contain a little bit of melatonin, not enough to make you tired during the day, but just enough to be supportive. But magnesium, again, we kind of talked about that in terms of that enzyme that breaks down that epinephrine and norepinephrine, which helps you to reduce those neurotransmitters that make you feel really awake and revved up, and help you kind of rest into sleep and sort of come into a restful sleep. Tart cherry juice is one that has gotten a lot of press about containing melatonin. It's a good one. Again, though, it kind of falls in the same category as bananas. Anytime we're drinking juice before bed, that there's going to be a little bit of a blood sugar response that happens. So again, that's why turkey and almonds are on the top of my list. Even though I'm seeing on the handout that I wrote bananas in between turkey and almonds, but really turkey and almonds should have been there in kind of a class by themselves, because they're really, really the good ones. Omega-3 fatty acids throughout the day, I don't recommend, actually very specifically do not recommend trying to take your fish oil supplement right before bed, or you will not like me, because you'll end up waking up burping fish, and that won't be good. So don't do that. But if you eat more omega-3 fatty acids throughout the day, it does help you to modulate your stress hormones. And anytime we can, so when I say modulate your stress hormones, that means, I know we're talking, I sort of throwing out a lot of melatonin, cortisol. So I'm actually going to take a minute here to just sort of talk about what we're talking about with those. Melatonin is a hormone that doesn't actually, it's not sedative. It doesn't actually induce sleep, but it sort of takes, it has a calming effect that allows sleep to happen, basically, is the best way to say it. Whereas cortisol is the hormone that wakes you up in the morning. We've talked about it a little bit in terms of stress hormones, and it's the thing that you produce both when you feel stress, but also it's naturally produced at higher levels in the morning. When some people, really their sleep disruption is related to a high cortisol level. And sometimes, the way that can present is that early morning waking, where they wake up, at that 4:30 time and can't go back to sleep. And then also it can be, where they wake up feeling really not so much anxious, but like a dread kind of feeling. That's not coming from the literature. That's just coming from clinically. What I've seen is like the people who wake up saying that they feel this dread, they respond better to working with cortisol. Whereas people who wake up with like their mind racing, they respond better to thinking about their blood sugar. So not 100%, but most of the time. So really omega-3 fatty acids, there's so many things to say about how they're helpful being anti-inflammatories, but this is just another way that they're really important and helpful. And most people actually don't get enough omega-3 fatty acids. So the best ways to add omega-3 fatty acids are walnuts and fish. Sardines, can be a hard sell, but I've had people come up with really amazing ways to hide them. I personally haven't quite found the best way to hide them. They're so good for you. Like really, if they're so good for you. They have a lot of calcium and they have a lot of omega-3 fatty acids, and I really want to like them. But a lot of people, sort of put them in their salad dressing, grind them up, put them in their salad dressing. I've heard of people like sort of putting them in sandwiches. That seems to make it a little bit better. So I'm seeing lots of skeptical looks about the sardines, but yeah. But salmon, of course, is really good. Yeah, flax seeds, like we talked about, do have some omega-3 fatty acids. So those are kind of more slightly easier ways to get those things. I don't recommend getting flaxseed oil. I think we talked about this back in the Food is Medicine, but as long as we're sort of talking, flaxseed is also on this list here. I don't recommend just getting flaxseed oil because it goes rancid so easily that by the time it's bottled and you open up the bottle and it's the day later, that oil is probably not so good to be ingesting. Very likely to cause some digestive upset actually, because it goes rancid so easily. So flax seeds, we're going to skip over oatmeal and come back to oatmeal in a second because I started in on flax seeds. They do contain tryptophan. So tryptophan we kind of like associate that the most with turkey, but tryptophan is a precursor to serotonin, which is another, if we were thinking about the three biggest things that impact sleep, it's melatonin, serotonin, and cortisol. Serotonin is the one that I think about the most when people have kind of a frequent waking, where they come in and they say, hey, I wake up every hour, I wake up every 2 hours, like a very light sleep. I also think about, when they talk about that, I also want to think about sleep apnea and a bunch of other things, but, and caffeine, whether they've had too much caffeine or any caffeine. For some people, caffeine is something that's hard to tolerate. In terms of tryptophan being a precursor to serotonin, it helps your body make more serotonin, which can kind of keep you into these deeper levels of sleep and prevent you from waking up more frequently. So the biggest things if you want to sort of hit that serotonin, if you heard me talk about low serotonin and that frequent waking, and that makes you think of yourself, turkey and flax seeds are going to be kind of your good go-tos. The other thing actually that I should have put on here, so I kind of was focusing on foods that are helpful. Oh wait, actually, let me talk about oatmeal and then I'll talk about caffeine. Oatmeal also contains melatonin, calcium, and magnesium. People always think about oatmeal as a breakfast. Well, I shouldn't say always. A lot of people think of oatmeal as a breakfast food. It's actually a fantastic dinner food. Oatmeal is really good for your heart health. So it helps to regulate your cholesterol and has a lot of good fiber in it. It has a lot of good nutrients. And it also contains calcium and magnesium, which are helpful for sleep, and a little bit of melatonin. So some people do eat oatmeal in the morning and that makes them feel great. For other people, oatmeal has a calming effect. And so that's where oatmeal for dinner is wonderful. It's great food. So yeah. And then, so as much as we want to think about these foods that are therapeutic, that can help when people have trouble sleeping, I also just really want to have a little like conversation about caffeine here. A lot of times people come in talking about their sleep and they talk about how they just feel like they never get into sleep, like they're sort of like half awake all night, or they wake up a lot frequently, or even sometimes for some people it shows up as they wake up at that 3-4 a.m. and can't go back to sleep. And when I say caffeine, they're like, no, I only have caffeine in the morning. And here it is. Unfortunately, that caffeine in the morning can affect your sleep at night. And they've done studies about, specifically, the studies I've looked at are more about people born with ovaries that, as their estrogen goes down, their ability to metabolize the caffeine decreases, so that their levels of caffeine, even into the night. So say they have their 9 a.m. coffee, that caffeine is still in their system. at night. So our ability to metabolize caffeine does change over time, and that's true for men as well. I don't have the exact, like the same kind of sort of sense about that in terms of the studies. There's not the same kind of level of studies, but I do see that happening. And someone will say, I've been drinking coffee all my life, and I'm actually drinking less coffee than I used to. But what I find is very often, if someone comes into me and they say that they're having trouble sleeping or they're feeling anxious, then I say, caffeine works okay for a lot of people, but for some people, the side effects really are really significant. And so sometimes doing a trial of coming off of caffeine, and I don't recommend coming off of caffeine quickly, sort of a slow transition off of it. So, every third day adding another quarter of, if you're doing coffee, another quarter of decaf, so that, it's like day one, it's 3/4 regular, 1/4 decaf, day 6, or day 3, half and half, day 6. So like that. And then, or switching to tea is another great way, because, you don't want to come off of caffeine too quickly, or you'll get some side effects there. It's worthwhile to do the experiment, to really try out what it feels like to not have, to take a month and see what it feels like to not have caffeine. People are often surprised that, after they get through the 2 weeks of withdrawal, that they often feel more energetic, and that it does make a lot of sense, because they're getting better sleep. So then they're actually getting this kind of like real energy, as opposed to sort of jet fuel energy. And so people find that their energy level is often a little bit more even keeled and a little bit more sustained. So actually, people are often surprised by that. Any questions about the foods or about caffeine? I know caffeine's a big one that people often want to ask questions about. Go ahead. Yeah.
Okay. How much of this food do you have to eat? Like how much turkey, how much peanut butter? Oatmeal, flax seeds.
Yeah. We're talking about normal, like a serving size. So it's not, each of these foods, like a normal serving. You don't have to go eat a whole turkey, to try to get this effect to happen. But, and that's where, when people start incorporating these foods a little bit more in single servings, and then sometimes that is where supplements come into play, is it's a way to get a little bit more of it if the food version doesn't really work. So say you spend 2 weeks, eating turkey sometime in the evening, and you don't really, you notice a little improvement, but it doesn't really get you all the way, so you go from like waking up 3 times a night to waking up 1 time a night. Then we might want to think about a supplement at that point, just to kind of get you a little bit more without you having to eat a lot of turkey. So really, really single servings. Almond butter, about a tablespoon, is really good. Bananas, I think of a banana, a serving size of a banana as a half a banana, which is really kind of annoying, because then you have this banana that's like sitting on the counter turning brown. But that is, really a reasonable kind of serving size when it comes to bananas. And then tart cherry juice, just, that like, about 2 ounces, has a good amount of 2 to 4 ounces, really. Omega-3 fatty acids, just more is better. When we're talking about foods, not when we're talking about supplements, but that's kind of a different conversation. So the more foods you can get that are omega-3 fatty acid rich, the better. The oatmeal, again, a serving size is good. Which for oatmeal, can, because of the fiber content, can be up to like, a cup, where a lot of other grains, I think of serving sizes as being a little bit less than that, but a cup of oatmeal is a great amount of oatmeal. And then flax seeds, you always want to work your way up on ground flax seeds. So, really 2 tablespoons is a therapeutic dose when it comes to cholesterol and omega-3 fatty acids. And, it's a good kind of thought as being like, that's the dose. And also I don't recommend that people just start with two tablespoons, partially because if your GI tract is not used to that, it can be a little disastrous. So kind of add a half a tablespoon every couple of days until you get up to 2 tablespoons is a good way to do that.
And turkey, are you talking about cold cuts? Or are you talking about the actual turkey breast?
Either one. So the when we talk about cold cuts, we do want to think about additives. So, getting the nitrate free cold cuts is much better. Nitrates there's some if this is going to be like kind of, as we're setting this up as like a habit, or something that some people might do, continuously, we do need to think about things like nitrates, because if you eat nitrates every single day, it can increase your risk of colorectal cancer. So so really, yeah, cold cuts are great, but if you get like the Applegate Farm ones, they don't have nitrates. There's a bunch out there that don't have nitrates. That's the only brand that's coming to mind right now. And cold cuts are great because they're easy. Go ahead, Lynn.
I'm wondering if it's the sugar in wine. Red wine is the big killer for me, the sleep killer. Wake up at 3, definitely. Or even let's say a margarita that might have had sugar. Some cocktails, they add simple sugar. So is that really a low blood sugar thing that's happening?
That's actually probably a double doozy, because there's the sugar, so that is going to cause a low blood sugar, but alcohol actually, it decreases your sleep quality. So it actually makes you a lighter sleeper, which is funny because people often identify it as something that helps them go to sleep, because it does have a sedative property. So it does kind of like make people go from awake to asleep, but then their depth of sleep stays much more, sort of like doesn't get quite as deep. So here you have a double whammy of something that's sweet right before, in the evening, and then you also have the alcohol that makes your sleep not go as deep. And then you want to throw a triple whammy on it if you have any kind of, even mild snoring or like slight sleep apnea, that will actually also cause another challenge that will make you produce more cortisol way in that early morning, like 4 o'clock. So yeah, alcohol. I'm so glad you brought up alcohol, because many people think of alcohol as sleep support, and really the way it plays out is that it's actually decreases, it makes your sleep quality worse. Yeah. And there are a lot of people who have that 3-4 a.m. waking after drinking alcohol as well. So yeah. Anything else? No. All right, let's talk about herbs. So again, we're going to talk about these herbs as teas. I'm not recommending that these are taken as capsules. There are quite a few interactions that are possible with these herbs. I did put little cautions below each of them, even chamomile, which is kind of surprising people, but there's a slight thing to kind of think about with chamomile there. So we'll get to that. And then at the bottom there, I knew, kind of knowing that this might come, I have a sort of like my 2 favorite tea formulations that I really like for people who want to try out tea for sleep. So kind of moving through the herbs, I always like to give people kind of a characterization of the herb. Very often especially with sleep herbs, we do tend to use them as like a formula, but it's kind of neat to like sort of get to know the herbs a little bit, like the feel of them. And also kind of like where for some people they might say like, oh man, like that valerian really speaks to everything that's a challenge for me. So you can do a plain valerian tea. It tastes gross, but it works really well. So valerian it has some GABA. It affects the GABA system, which is the same system that alcohol actually affects, and also, but in a slightly different way. Also benzodiazepines, if you're familiar with those. The valerian is one that's also an excellent muscle relaxer. So if people tell me that they wake up and their back is really tight, or just that they have muscle tightness in general, or they have a lot of headaches or tight neck muscles, valerian is a great one, if they're also having trouble sleeping. The caution here is that I've seen it before, probably like in my practice, I feel like it's maybe like, 2 out of 100-ish that have this opposite reaction to valerian, where they actually feel more anxious, restless, and awake after. Yeah, and I do wonder if there's a correlation between people who have that reaction to Benadryl. I don't know if you've ever encountered somebody who has that reaction to Benadryl, where Benadryl makes them hyper, and valerian. It doesn't really make sense, because Benadryl is about the cholinergic system, and valerian is really about the GABA system. But my sort of like little sample size tells me that I do wonder if there's an association there. Anyway, all that to say, maybe try valerian for the first time, not before like a big presentation that you're going to do or something like that, because in case it had that opposite effect. So, it's really good. You can also apply valerian topically. So if you have a lot of muscle aches, you can make yourself a bath tea that has some valerian tea bags in it and some Epsom salts, and you're going to feel a lot better and probably pretty relaxed. And lemon balm is great. Lemon balm is a good one. Doesn't have that sedative property. Some people can take valerian. So valerian does have a sedative property. When I say sedative, it means like makes you go to sleep, versus like a calming effect or a nervine effect, which is something that you can do during the day. Some people, can do low doses of valerian during the day for a calming effect, but for a lot of people, valerian can have a sedative type effect. Lemon balm doesn't have really as much of that sort of sedative effect. It actually has more of a calming effect. So I find it most helpful when people are kind of have more of these, they come in and say that they have trouble falling asleep because of their thoughts, their anxious thoughts about the following day, or about anything that's going on in their life. So it's a great one to drink during the day. It tastes really good. Valerian tastes disgusting. It kind of tastes like gym socks, but these formulas make it taste okay because they kind of hide it with a bunch of other herbs. But lemon balm tastes lovely. It's a great tea, and it's especially good for people who have kind of that tendency towards their digestive upset when they're stressed or anxious. Really can help a lot with that. The one caution on lemon balm is if someone has a thyroid condition, we don't like to do lemon balm because it can affect the thyroid. It's fine to drink a cup of lemon balm tea a day, but I just wouldn't do like 5 cups, or make your big pot of lemon balm tea to drink throughout the day. If you can discuss that with me if that applies to you, about whether or not that would be okay to do. Chamomile tea, good old chamomile that kind of shows up in most. It has this apigenin, which is also in passion flower. So that also works on that GABA system, which is that same one that the valerian works on, that has that kind of calming effect. Which is not necessarily a sedative, but a calming effect for chamomile. And it also is really great for, when people have sort of more of a digestive upset, like that burning, more refluxy, stomach burning kind of feeling. Again, if you're having that, consistently, definitely talk to me or your doctor about that. But just if you know that you ate, something spicy and it's really, you're paying the price, chamomile tea is a great one. It's also really good on bug bites. If you have one of those itchy, painful big bug bites, you just put the chamomile tea bag right on there. I do see that some people, chamomile tea does, makes their allergies worse. I've had a couple people where it's just come up randomly. Like one person, it was like the middle of winter and she was like, why are my allergies so bad? And I was like, are you drinking chamomile tea by any chance? And she said, yes. And she, because I knew that she had a ragweed allergy. So they are in the same family as ragweed. So for some people that can make their allergies worse. And what it usually shows up as is like a little bit of sometimes like that slight itchy back of your mouth, sometimes like a little eye irritation, sometimes nose. This time of year, good luck knowing what's causing what, but that was just sort of more remarkable just in the winter time, that she suddenly had this flare for allergies. So, if you know for a fact that you're allergic to ragweed, you might want to steer clear of chamomile. It's not like it's going to really harm you in some profound way, but it might make you have a little bit of allergies. Passion flower also has an antispasmodic, which means that it relieves sort of that like twitchy, like sort of feeling. And it has a calming effect. The difference between, when we talk about, valerian having muscle relaxing effects and passion flower having muscle relaxing effects, valerian I like more for muscle sort of tension and muscle tightness and muscle spasm, whereas passion flower is really great for sort of more of a restlessness, like that restless leg, or feeling like you just have to, when you feel like tossing and turning is the term that people often use when they think about it for sleep. Passion flower is great for that kind of restlessness. And we do, passion flower is another one that, at higher doses, we do have to be careful, especially with blood pressure medications, but there's some other medications because of the liver pathway it uses. But again, a cup of tea that has passion flower as one of the herbs is definitely not going to cause a problem there. And these are the 2 formulas that I really like, are the Gaia Herb Sleep and Relax. And that one doesn't have valerian. So I often start there because valerian, because of it tastes gross and also because of this potential of it having the opposite effect. It's kind of good to see, like, can we do it without valerian? And then if something that's a little bit stronger is the Numi Sweet Slumber, and that one does have valerian in it. So yeah, I do want to say a little bit about melatonin just because it's out there and it's like something that a lot of people use because it's kind of like sold under a lot of names as a sleep supplement. I'm not a huge fan of like, universal melatonin use for people who have trouble sleeping. I use it really on a case-by-case basis. Partially because it's a hormone. Anytime we're doing something with a hormone, we need to be thinking about it as a hormone. And I tend to like want to be sort of respectful of hormones because, the body really regulates them so carefully. And so the more we kind of stand back and let them do their own thing is the better. And a low dose melatonin supplement is really different from like a high dose. A lot of people, and when I say low dose, I'm talking about, 1 to 2 milligrams, 1 to 3 really. But a lot of people do 5-10 milligram melatonin supplements. And I actually don't really, I can't think of a time recently that I prescribed 5 milligrams or 10 milligrams. Partially because it doesn't work. I don't see it working very well. And also partially because it often causes this morning grogginess. And also I think that's people getting more melatonin than their body would normally make. And anytime I think about hormones, I never want to give people more than what their body would naturally make. The times that I really do use melatonin is when people have two big times. One is for people with reflux because it helps to strengthen the lower esophageal sphincter at a low dose. When they've done studies of melatonin in terms of like, sleep quality and everything, it's pretty surprising that it doesn't help all that much in terms of preventing, helping people stay asleep, but it does help people fall asleep a lot. So the other time that I use it is when people have what they call a sleep delay. So when they're the night owls, like, the people who like that, their natural, like, sleep schedule is, midnight or later, to late in the morning. And if they want to shift that, like say they get a job where they have to be there at 8 o'clock in the morning, if they want to shift that, what we do is we do a low dose melatonin at their bedtime. We're really careful about light exposure. And then in the morning, we very specifically say, okay, this is get light exposure, get outside, see the sun, get as much light exposure as you can at the time that you're supposed to wake up. And that helps to retrain the sleep cycle back a little bit. I will say some people's bodies are just sort of tuned to be, this later sleep cycle. And that is, it's a hard one to overcome sometimes. But that's the way that we do it, is using melatonin to shift that. And I guess on that same kind of vein, I use melatonin for people who are shift workers and having like a swing, their shift is changing. So sometimes they work nights, sometimes they work days. We use melatonin to help them sort of adapt quickly to this changing sleep schedules. And also people who have jet lag. That's another time it's really helpful to sort of reset the sleep cycle. So there's a lot of benefits to melatonin. Like, there's studies coming out all the time about like cancer prevention and specifically breast cancer prevention. That's where it's like pretty compelling how great melatonin is. And also what I really stand by is that the best way to have more melatonin is to make more melatonin as opposed to taking it as a pill. And the things we talked about at the beginning, all those behavioral changes and like preventing light exposure and things like that, and are really the best ways to help your body make more melatonin. And then melatonin will cruise around and give you all those health benefits that you might be reading about with melatonin. So all that to say, melatonin is definitely not my first go-to on a sleep supplement, even though it's kind of out there in the pharmacies. Actually, in other countries, it's a prescription only a medication, which I actually think it makes a lot of sense because it is a hormone, and it's, I think it might be overused actually. So that's all with that. And then I'll kind of like go right into resources just because I want to leave Q&A in case people have to leave right at 1 o'clock. So some more resources that are available are acupressure. So there's a whole program called Acupressure for Sleep, which when I talked about the kidney one on your foot, you can do there's a whole thing with doing Qigong, which is like a shaking movement that's really from Chinese medicine, and then also doing some different acupressure points that you can rub for sleep. And that's, I gave you the on the handout, there's the link to that. That's Leilani Navar, who actually was going to be a guest speaker in June, and hopefully moving forward. She's fantastic, and she just very lovely, and this program has been very helpful for a lot of people. Sleep stories, I put the Calm app down. That's my favorite one for the sleep stories, but I'm sure there's other great ones out there. And YouTube, you can do the calm sleep stories on YouTube. One of the things that's really annoying about that though is that like there's sometimes a commercial in the middle of it, and it's so you're like falling asleep and then there's a commercial. So and then meditation to support sleep that you do during the day. The Headspace actually has a great one that's really about like, you know, sort of a meditation you could do during the day that will help your sleep at night. And then there's a lot of great, you know, sleep meditations that help you fall asleep. One to do is this progressive muscle relaxation. And a lot of times you do it once and then you learn how to do it, and then you can kind of just do it for yourself after you do it that first time. Many of you have probably already done it in some context, but it makes you tighten your muscles and then relax them, and then you go through your whole body and do that process. And so I just gave you one of the ones I like about that one. And then there's a sleep meditation by Tara Brach that is lovely, but again, it's one of many that are out there. So yeah, it's 1:00. If anybody needs to go, it's totally, I fully support you in going about your day, but I'm also here. I'm glad to answer some questions if you'd like. Yeah, go ahead.
So one of my major problems with sleep at night is I get sore muscles.
Mm-hmm.
And I know it's related to my weight because 65 pounds ago and a few years ago, it really wasn't an issue.
Mm-hmm.
And, you know, now it is that I put on a lot of weight and I'm over 50. And what ends up happening now is I end up taking a couple of Tylenol every night when I go to bed. And I don't feel good about it. I don't feel good about the fact that I have to do that. Would something like either the chamomile or the valerian tea, do you think it would provide enough relaxation? Because what happens is I'll wake up at if I don't do that, I'll wake up at 3 a.m. and just feel very stiff and sore. And I think it makes me flip a lot too, where I'm on both sides or sometimes on my back.
Mm-hmm. Yeah, definitely. I would lean a little bit more towards the valerian, kind of with that sort of a picture of that, like sort of waking up sort of stiff and achy and painful. The other thing is mattresses, you know, it's a hard thing to think about like changing a mattress, but sometimes really it is about a mattress and needing to have a little bit more, this kind of combination of, you know, a lot of times when people have too squishy of a mattress, or if it's an older mattress, it'll sort of, that hammock effect will create that problem of getting sort of stiff and tight at night. And particularly also, you know, like different body types that you need more of that support. And so sometimes that extra support would help. The other thing is that Epsom salts, you know, doing like a hot shower with Epsom salts before bed, you know, even that kind of rubbing, you can either take them and rub them with your hands, or you can put them in a sock and just rub the sock all over you, especially like on your back, you know, the places that do get tight. And that can make a really big difference. And the shower kind of as hot as you can stand it. To be without burning yourself, of course. You know, I feel like I have to say that. So yeah, those things might help. And also definitely talk to me if you want to, you know, if you want more ideas, because there's more where those came from, but they're ones I wouldn't necessarily do kind of like in a general sense, but there's a lot more on that. Oh, and the last one that I'll say, because I feel totally comfortable in a general sense, is sometimes it's about pillows. And people, when they feel lower back pain, they never think about it being their pillow, but it can be, because if your neck is jacked like this a little bit, it pulls on your lower back. So getting a pillow that keeps your neck in a neutral position. And one of the ones that, I actually don't know the term for them, but they kind of go like, they have like 2 bumps on them. So like, it's like the middle is kind of down. Those are really excellent because they put your head in a nice neutral position. And really watching, because a lot of people, you can have the flat pillow or you can have the too big pillow, and both of those will actually a lot of times show up in like lower thoracic, upper lumbar kind of pain. So that's another place to look. And it's a lot easier to get a pillow than a mattress. So yeah, start there. Yeah.
Okay, thank you.
Absolutely. Anybody else? No? All right. Well, wonderful. So good to see you all. And I'll see you next week, and we'll be talking about skin cancer. I mean, if you would like, I should say. All right. Take care. Have a good day.